Every morning, before most people have spoken a single word, they do something that quietly damages one of the most important organs in their body. Not once in a while, every single morning. And the damage compounds, month after month, year after year, until the liver can no longer compensate, and it stops compensating without warning. Your liver performs over 500 distinct metabolic functions every day. 500. It filters every substance that enters your bloodstream. It manufactures proteins your blood needs to clot. It stores glucose, regulates blood sugar, and produces bile that allows your gut to absorb fat-soluble vitamins. When it begins to fail, everything fails with it. And in most people, the early damage is completely silent. I have spent 15 years in clinical practice watching the same morning habits destroy the same organ in the same silent way, in patient after patient. Today, I am going to be very specific about what those habits are and exactly how to stop. Subscribe to Be Well right now and hit like. Let's get into it. Picture this. It is 7:15 in the morning. You are standing in your kitchen, still in your robe. You have not eaten since last night. Your liver has been working through the night, processing, repairing, clearing the metabolic debris from the previous day. It is in a vulnerable state. Its glycogen stores, the glucose it saved for morning fuel, are at their lowest point of the day. Its detoxification systems are primed and ready to begin their morning filtration cycle. And then you do the first thing. You pour a cup of black coffee and take 3 or 4 medications on an empty stomach before anything else has touched your digestive system. You wash them down, and within 45 minutes those substances hit your liver in a concentrated wave. No food buffer, no bile dilution, nothing to cushion the load. 20 minutes later, you sit down with a bowl of cereal or white toast with jam. Processed carbohydrates that spike your blood sugar rapidly. Your liver is now forced to immediately begin converting the glucose spike into glycogen, then into fat, while simultaneously metabolizing the medications that arrived first. I see this described to me, with small variations, by nearly every patient over 50 who comes in for a hepatology referral. Hepatology is the medical specialty of the liver. The word comes from the Greek hepar, liver. The referral itself comes from years of slowly accumulating damage that nobody identified because the liver, like the kidneys, does not hurt when it is struggling. By the time a liver function test returns abnormal in a routine panel, the organ has often already undergone significant structural change. The most common diagnosis we find at that point is NAFLD, non-alcoholic fatty liver disease. In the United States alone, an estimated 100 million people have it. Globally, it is the most common liver condition in the developed world. And for the majority of them, the cause is not alcohol. The cause is how they spend their mornings. The first thing I need to clear up is this. Liver disease is a drinker's disease. If you don't drink heavily, your liver is fine. That belief is wrong, and it is putting millions of people at risk. Non-alcoholic fatty liver disease has nothing to do with alcohol consumption. It is driven by metabolic dysfunction, specifically by chronically elevated insulin, which directs the liver to convert excess blood glucose into fat and store it within the liver tissue itself. The more frequently insulin spikes, and in the average Western diet, it spikes multiple times every morning, the more fat accumulates in the liver. A 2023 review published in the Journal of Hepatology, covering data from 34 countries, found that NAFLD affects approximately 30% of the global adult population. That is nearly 1 in 3 adults. And the overwhelming majority of them do not drink heavily, do not smoke, and believe they are relatively healthy. The second myth: if your liver enzyme tests came back normal, your liver is fine. Liver enzymes, specifically ALT and AST, are released into the blood when liver cells are damaged. They are a useful marker, but they are also a late marker. In early-stage fatty liver disease, Enzymes can remain normal for years, while fat accumulation and early inflammation are already present. The enzyme levels rise when cell death begins, not when the problem starts. Relying solely on enzyme tests for liver health is like using a car's temperature warning light as your only engine monitoring tool. By the time it lights up, something has already gone wrong. To understand why morning habits matter so much specifically, you need to understand what your liver is doing at that time of day. Think of your liver as the body's overnight chemical processing plant. During sleep, it runs in maintenance mode, clearing metabolic waste from the previous day, synthesizing proteins needed for the next morning, and maintaining blood glucose levels stable enough to keep your brain running through the night. It does this by drawing on glycogen stores, a form of stored glucose packed into liver cells. By morning, those glycogen stores are partly depleted. The liver is in a state biochemists call the fasted state. In this state, it is exquisitely sensitive to incoming signals. The first signal it receives in the morning determines what metabolic program it runs for the next several hours. If that first signal is a large glucose spike from a sugary breakfast, a sweetened drink, or refined carbohydrates, the liver receives a massive insulin signal and immediately shifts into fat synthesis mode. De novo lipogenesis is the formal name, the creation of new fat from carbohydrate. This is one of the primary drivers of fatty liver accumulation in people who do not drink alcohol. If that first signal is a concentrated chemical load from multiple medications taken simultaneously without food, the liver must immediately activate its phase 1 and phase 2 detoxification pathways. These are the enzyme systems the liver uses to transform foreign chemicals into water-soluble forms that can be excreted. Running both fat synthesis and detoxification simultaneously in the fasted state places extraordinary oxidative stress on liver cells. Oxidative stress means the production of damaging reactive oxygen molecules that injure cell membranes. This is the biochemical mechanism behind medication-induced liver injury, a category of liver damage that is the second most common cause of acute liver failure in developed countries. The morning is the most critical window for your liver. What you do in the first 30 to 45 minutes after waking determines whether that organ is protecting you or slowly being damaged. Let's go through what specifically causes the damage. Morning habit 1. Taking multiple medications simultaneously on a completely empty stomach. This is the habit I address most frequently in patients with elevated liver enzymes. Several very common medications are particularly hepatotoxic, meaning toxic to liver cells, when taken without food. High-dose acetaminophen, statins taken at the wrong time of day, metformin in excess doses, certain antibiotics, and anti-inflammatory medications. The key issue is not any individual medication at prescribed doses. It is the combination effect of multiple drugs arriving in the fasted liver simultaneously, combined with individual variation in liver enzyme activity, which is genetically determined and not tested in standard care. Practical step: take your medications with or after food, not before. Ask your prescribing physician specifically, which of these medications should be taken with food and which can be taken without. A 15-minute conversation about timing can reduce your liver's morning chemical load substantially. For over-the-counter medications, particularly acetaminophen for pain, never take more than the minimum effective dose and never take it on a completely empty stomach. Morning habit 2. Drinking sweetened or processed beverages as your first liquid of the day. This includes sweetened coffee drinks, flavored creamers, packaged fruit juices, sports drinks, and, one that surprises patients, vitamin water and functional beverages with added sugars or artificial sweeteners. In the fasted morning state, fructose is particularly damaging to the liver. Fructose, the sweetening component in high fructose corn syrup and in most commercial juices, is metabolized almost exclusively by the liver. Unlike glucose, which is used by every cell in the body, fructose goes almost entirely to the liver for processing. In the fasted morning state, when liver glycogen is depleted and the organ is maximally sensitive to incoming signals, a large fructose load triggers aggressive fat synthesis. A glass of apple juice in the morning contains as much fructose as a can of soda. Practical step: your first drink of the day should be plain water. After that, plain black coffee or green tea, both of which, consumed without added sugar, have demonstrated hepatoprotective properties in multiple clinical studies. The polyphenols in green tea and the chlorogenic acids in coffee have been shown to reduce liver inflammation and support healthy enzyme activity. Morning habit 3. Skipping breakfast entirely after staying up late. This habit intersects with the liver's circadian clock, its internal biological timing. Your liver operates on a 24-hour cycle coordinated with your light-dark exposure and meal timing. Research published in the journal Cell Metabolism has demonstrated that the liver's metabolic enzymes follow predictable daily rhythms. When meal timing is severely disrupted, such as eating the last food of the day very late at night and then not eating until noon or later, the liver's internal clock desynchronizes from the body's overall circadian rhythm. This desynchronization increases liver fat accumulation, impairs glucose metabolism, and elevates inflammatory markers, independent of total caloric intake. The most hepatoprotective eating window is last meal before 8 p.m., first meal within 90 minutes of waking. This simple timing pattern, without any change in food quantity, has been shown in clinical research to reduce liver fat content measurably over 8 weeks. Morning habit 4. Chronic morning dehydration, reaching for coffee before water. Overnight, your body loses approximately 500 to 700 milliliters of water through breathing and perspiration. You wake dehydrated. Your blood is slightly more concentrated. Your bile, the liver's digestive secretion, is thicker. Thick bile does not flow properly through the bile ducts, which creates back pressure in the liver and reduces its ability to clear metabolic waste. The liver's detoxification pathways require water. Phase 2, detoxification, the conjugation step where the liver attaches water-soluble molecules to neutralize toxins, is directly impaired by dehydration. Yet the majority of people's first fluid intake of the day is a diuretic, coffee, which further reduces total body water before the liver has had a chance to restart its morning filtration cycle. Practical step: a large glass of water, at least 300 milliliters, before anything else. Before the coffee, before the medication, before the breakfast. Let the liver rehydrate its processing environment before loading it with anything else. Now let's talk about what to add, not just what to remove. There is a drink that is extraordinarily well supported by clinical research for liver function, costs almost nothing, and is prepared in under 3 minutes. You have probably seen versions of it and dismissed it. You should not dismiss it. The base: warm water with fresh lemon juice and a small amount of raw, unfiltered apple cider vinegar. Here is the mechanism. Lemon juice provides citric acid and vitamin C. The vitamin C component is the primary driver of the liver benefit. Vitamin C is a direct precursor to glutathione synthesis, your liver's primary internal antioxidant. A randomized controlled trial published in Frontiers in Nutrition found that vitamin C supplementation in NAFLD patients over 12 weeks produced significant reductions in both ALT and AST liver enzymes, with the effect working through the antioxidant pathway, specifically by reducing the oxidative stress generated during Phase 1 detoxification. Glutathione neutralizes the reactive oxygen molecules that are an unavoidable byproduct of the liver's morning filtration work. The citric acid in lemon juice contributes to overall organic acid intake. but it is the vitamin C that carries the direct, documented liver support function. Vitamin C is required for the synthesis of glutathione, your liver's primary internal antioxidant. Glutathione neutralizes the reactive oxygen molecules generated during phase 1 detoxification. Without adequate glutathione, phase 1 detoxification produces toxic intermediate compounds that can damage liver cells. Supplementing vitamin C in the morning replenishes the glutathione production system before the morning detoxification cycle begins. Apple cider vinegar contains acetic acid and a range of organic acids that have been shown in research published in the European Journal of Clinical Nutrition to improve insulin sensitivity. Improved insulin sensitivity means the liver receives a smaller, more controlled insulin signal after meals, reducing the fat synthesis drive that is the core mechanism of fatty liver disease. A 2021 systematic review and meta-analysis published in BMC Complementary Medicine and Therapies pooled data from 9 randomized controlled trials and found that apple cider vinegar consumption produced statistically significant reductions in triglycerides, total cholesterol, and fasting blood glucose in adults across multiple metabolic conditions. The mechanism, supported by research on acetic acid specifically, involves improved insulin sensitivity at the cellular level, which reduces the fat synthesis signal the liver receives after meals. Robust human trials directly measuring liver fat using imaging are still limited, but the metabolic improvements ACV produces are precisely the upstream conditions that drive fatty liver accumulation. Preparation: 200 to 250 milliliters of warm water, not hot, not cold. The juice of half a lemon, freshly squeezed. 1 tablespoon of raw, unfiltered apple cider vinegar, the type with the visible cloudy sediment called the mother, which contains the beneficial bacterial cultures and organic acids. Consume this 15 to 20 minutes before your first meal. This is not a magic cure. It does not reverse liver damage that is already structural, but is part of a morning routine that removes the 4 harmful habits and adds this protective drink. The cumulative effect over 3 to 6 months is measurable in liver function tests. Write your age in the comments right now. I want to know exactly who is watching this because the morning habits that do the most damage and the most effective interventions are genuinely different at 45, 55, and 65. Different enzyme activity, different bile flow, different glycogen storage capacity. Your age tells me which sections of this information matter most for you specifically. Unlike the kidneys, which give almost no symptoms until late-stage damage, the liver does send some earlier signals. Most people miss them because they don't know what to look for. Signal 1. Persistent fatigue in the afternoon, specifically between 1 p.m. and 3 p.m., even when sleep was adequate. The liver has its peak detoxification activity in the early afternoon, coordinated with the body's circadian system. When the liver is under metabolic stress, this detoxification peak can cause a measurable dip in energy. The body's resources diverted from activity toward filtration. Most people experience this as the afternoon slump and attribute it to lunch. In many cases, it is the liver working at the edge of its capacity. Signal 2. Right side abdominal discomfort or a sense of pressure under the right rib cage. The liver sits under the right rib cage. When it is enlarged from fat accumulation or inflammation, a condition called hepatomegaly, it can cause a dull, heavy discomfort or a feeling of fullness on the right side. This is subtle. It does not feel like pain. It feels like something is slightly in the wrong place. Most people ignore it. If you have had a persistent right side heaviness for weeks or months, have your liver evaluated. Signal 3. Skin changes, itching without rash, spider veins appearing on the torso, or a slight yellowish tone to the skin or whites of the eyes. The yellowish tone is called jaundice. In its mild early form, the easiest place to detect it is the whites of the eyes in bright natural light. It indicates that bilirubin, a bile component, is accumulating in the blood because the liver is not processing it efficiently. Even mild jaundice in an adult is worth evaluating promptly. Signal 4. Bloating and digestive discomfort that does not respond to digestive aids. Bile production and release is a liver function. When bile quality or quantity is compromised, fat digestion becomes inefficient. The result is bloating, discomfort in the upper abdomen after fatty meals, and sometimes pale or greasy stools. If your digestion has shifted in this way over recent months, liver function is worth testing. Signal 5. Hormonal changes in both men and women. The liver is the primary site of sex hormone metabolism. It processes and clears both estrogen and testosterone after use. When liver function is impaired, hormone clearance slows and levels build up abnormally. In men, this can manifest as gynecomastia, breast tissue enlargement, or sexual dysfunction. In women, it can manifest as irregular cycles, estrogen-dominant symptoms, or worsening PMS or menopausal symptoms. These are not commonly associated with the liver in mainstream clinical practice, but the biochemical connection is well established. 3 specific tests tell you where your liver actually stands. ALT and AST, alanine aminotransferase and aspartate aminotransferase. These are enzymes released when liver cells are damaged. Elevated levels indicate active cell injury. Normal ALT is typically below 40 IUL for men, below 35 for women. Normal AST is similar. Elevated levels, even mildly elevated, in the context of the habits we've discussed warrant investigation. Ask for these specifically. They are not always included in a basic metabolic panel. GGT, gamma-glutamyl transferase. This enzyme is specifically sensitive to alcohol consumption, fatty liver disease, and certain medication effects. It rises earlier than ALT and AST in many cases and is a more sensitive early marker. Many physicians don't routinely order it. Ask for it. Liver ultrasound. This is not a blood test. It is an imaging study. An abdominal ultrasound takes approximately 20 minutes and can visually identify hepatic steatosis, fat in the liver, even when enzyme levels are still normal. If you have any of the symptoms or habits we discussed and your enzyme levels are borderline, push for an ultrasound. It is the only way to see the actual state of the liver tissue. The combination of ALT, AST, GGT, and an ultrasound gives a complete picture. Those 3 components together tell you more in one afternoon than 5 years of ignoring symptoms. I want to tell you about David, 57 years old, financial analyst. He came in not for liver concerns, but for a physical his company required for insurance purposes. His liver enzymes, ALT82, AST68, both significantly elevated. His GGT, 134, more than 3 times the normal upper limit. He had not touched alcohol in 10 years. He looked at the results and said, "Is this serious?" I asked him to describe his mornings. He told me, 6:30 a.m., coffee with 2 tablespoons of flavored creamer, 4 medications taken immediately, a statin, blood pressure medication, a vitamin D supplement, and ibuprofen for a chronic shoulder issue. An hour later, a bowl of cereal with whole milk. Work started at 8 a.m., no more food until noon. There it was. A statin in the morning without food. Statins are best tolerated with the evening meal, and their hepatic effect is minimized by timing. Ibuprofen every morning on an essentially empty stomach. Flavored creamer with processed sugar as his first liver signal of the day. And a chronic pattern of leaving the liver without food support for the first hour of its most active period. We made 4 changes. First, all medication shifted to evening with his dinner under his cardiologist's guidance. Second, the ibuprofen was replaced with topical anti-inflammatory gel for his shoulder and physical therapy. Third, Morning routine began with 300 ml of water, followed 15 minutes later by the lemon and apple cider vinegar drink. Fourth, breakfast moved earlier, within 30 minutes of waking, and consisted of eggs, avocado, and whole grain bread rather than sugary cereal. No new medications added, no supplements beyond what he was already taking. At 8 weeks, we retested. ALT, 41, AST, 33, GGT, 78, all trending significantly down. His shoulder improved with proper treatment. He said he had not felt this clear-headed in the morning for 5 years. I thought the tiredness was just stress, he told me. It wasn't. It was my liver working too hard from the first minute of every day. At 12 weeks, his GGT was 52, borderline normal. At 6 months, his ultrasound showed a reduction in the mild steatosis that had been visible on his initial scan. The liver is extraordinarily regenerative. Given the right conditions and removed from the wrong ones, it recovers in ways most people are never told are possible. Here is what to do, starting tomorrow morning. 1. Before anything else, drink 300 milliliters of plain water. Before coffee, before medication, before any food. Let the liver rehydrate its processing environment. 2. 15 minutes later, prepare the liver support drink. 200 ml warm water, juice of half a lemon, 1 tablespoon raw unfiltered apple cider vinegar. Drink it slowly before breakfast. 3. Take your medications with or after food. Discuss timing with your physician. Specifically ask about morning versus evening dosing for each medication. 4. Your first meal should contain protein. Eggs, cottage cheese, Greek yogurt. Protein provides amino acids the liver needs for detoxification chemistry. A sugary cereal spike is the worst first signal you can give the fasted liver. 5. Last meal before 8 p.m., first meal within 90 minutes of waking. This single timing adjustment without changing what you eat has clinical evidence behind it for reducing liver fat. 6. Get ALT, AST, and GGT tested at your next blood panel. Ask for GGT specifically. It is not always included by default, and if levels are even mildly elevated, request an abdominal ultrasound. 7. Count your daily fructose. Eliminate packaged fruit juices. Replace with whole fruit. The fiber in whole fruit slows fructose absorption and prevents the liver concentration effect that juice creates. Your doctor at a routine appointment is not going to walk you through liver protective morning habits. There is no time, and the pharmaceutical approach is far easier to bill for than a conversation about morning routines. The system profits from managing fatty liver disease with medication, not from preventing it with information. I'm telling you because that is exactly what this channel is for. Subscribe to be well. Hit like. And if you found this useful, share it with someone whose morning routine you know could be better. One video shared to the right person changes their trajectory. Write your age in the comments. The liver's regenerative capacity is genuinely different at 50 versus 65, and I want to build content around exactly where you are. See you in the next video.